We have had the opportunity to touch hundreds of thousands of lives in our community. More than a number or a statistic, these are the people, our friends, family, and neighbors who have relied and continue to rely on us to be there. As always, our greatest honor is caring and providing for our community. We provide for patients who depend on us to be there to provide local quality care and to improve overall health and well-being of our community. We provide for hundreds of employees and their families. And we provide an economic stimulant for community partners and other businesses providing support services to our organization. In 1942, a group of concerned citizens met to discuss establishing a hospital in Coldwater. Then, in 1945, in an empty storeroom where Hibner's Jewelers is presently located, Joseph Oppenheim, part owner of New Idea Incorporated, called a meeting to further discuss access to medical services for Coldwater and the surrounding areas. That meeting resulted in the establishment of a new corporation entitled the Coldwater Mercy Hospital Association. On November 9, 1949, groundbreaking services were held with Father Yoss, pastor of Holy Trinity Church Coldwater, officiating. On April 20, 1950, the cornerstone for Our Lady of Mercy Hospital was laid. The dedication of the 48-bed hospital was held on December 3rd, and on December 6, 1950, Our Lady of Mercy Hospital opened its doors. 2 decades later, in 1969, the Sisters of Mercy approached the hospital board, advising they could no longer continue to operate the hospital. Discussions began on how to keep the hospital operating. After much deliberation and planning, on April 1, 1972, 7 townships in Mercer County stepped forward to oversee hospital operations as a joint township district hospital. The townships involved were Butler, Marion, Granville, Franklin, Washington, Gibson, and Recovery. Discussions on renovating and expanding the hospital began immediately. The late 70s and 80s saw much renovation and growth, with the completion of a renovation project in September 1977, the opening of an emergency room staffed 24 hours a day in February 1978, and a $5 million major expansion project which was completed in 1984. The organization also added the Community Medical Center in Salina in April 1981 and Mercer County Home Health Agency, now Mercer Health Home Care, in October 1987. Through the late 1990s and early 2000s, 5 of the 7 remaining townships in Mercer County joined the original 7 in operating the hospital as a joint township hospital district. Therefore, in 2004, Mercer County Joint Township Community Hospital became known as Mercer Health, to better reflect its commitment to serve the health needs of residents in Mercer County and the surrounding area beyond traditional hospital services. Another major expansion was completed in December 2009, adding new space for the emergency department and outpatient services. Since 2010, Mercer Health has purchased the old Briarwood Manor building and surrounding land to allow for future expansion, raised and memorialized the former annex building, which originally housed the nuns operating Our Lady of Mercy Hospital, now known as Mercer Health, and moved Mercer Health Home Care, Mercer Health Medical Equipment, and Mercer Health Rehabilitation Services provided by the Community Sports and Therapy Center to the Galleria in Salina. The visionaries that made this organization a realization in December 1950 had a desire to make quality healthcare available locally. Building on that promise, initiated by the forefathers of this organization, Mercer Health continues to provide local quality healthcare, quality employment, and strong economic support to our community partners. Today, Mercer Health continues to be one of the very few hospital systems governed by local government, the townships of Mercer County. Mercer Health is your hometown healthcare provider, and with the continued enthusiastic support of the community, Mercer Health will continue to care for their own, just like envisioned in the 1940s. The future of our community's health begins now. In order to continue to meet the healthcare needs of the community, an expansion project is necessary. Surgical services have seen nearly 25% growth in the past 2 years. Currently, the surgery department is located in the original 1950 building. The expansion will meet the needs of the surgical volume growth by providing adequate space and improved functioning. Private rooms in all inpatient spaces have been a long-time request from the community and is the gold standard in new hospital construction. In addition to privacy, private rooms allow for better infection control and can reduce noise disturbances, thereby improving patient sleep. Outpatient services equate for nearly 75% of all services provided at the hospital, a major shift from the traditional care model. Currently, many of the outpatient services are decentralized, including injections and infusions, chemotherapy, pain management, central line, and implanted port care. The expansion will meet the needs of outpatient growth while allowing for increased accessibility for patients and visitors. We welcome your continued support as we build on the promise between the community and the organization made nearly 70 years ago. For more information about this major expansion project and how you can support it, contact the Med Foundation of Mercer Health or visit mercer-health.com.